Here at Russ Greiner. We're here to presenting about a little bit about the DAMA conference, the DAMA meeting coming up. So you're talking more about what's going to happen, what the events you're going to be speaking about. So can you tell us a little bit about yourself and the background you have in AI right now?
Thank you for inviting me. So
Yeah.
I'm an old man. I've been working in AI for the last over 45 years since my first publication in the field. I've been involved in many, many areas over the decades. The last 20 or so years, 25 years, has been looking at medical applications. In that context, looking at a variety of applications from cancers to psychiatry to diabetes, looking at clinical features, looking at histology and electronic patient records, looking at omics, metabolomics and genomics, even things looking at cell phone apps to try to use that to try to get information. So it's been very, very exciting. My own context, I'm actually a professor in computing science. I'm also an adjunct in the Department of Psychiatry. I've been at Edmonton, University of Alberta for 27 years. Hard to believe. I'm a CIFAR AI Chair. I'm one of the founders of what's now called AMII. So again, it's been lots of exciting areas, and I've seen the field of AI go from being this fringe topic on the side that no one quite knew about to being very prominent in machine learning days, and now being everyone in the world knows about it with this new AI generative models that are caught the world.
Yeah. Well,
So
that's a lot of topics. That's a lot of
indeed,
topics.
indeed.
So when it comes to DAMA then and the event coming up, what are you going to be highlighting and what are you going to be speaking about then?
Okay. Well, I'm not gonna talk about the new phase of generative AI. I'm gonna focus on machine learning, which is a way to take a data set of information and produce a model, and that model can then answer questions. So I'm going to talk about medical examples, although again, it applies to many other fields. You have a specific question you want to ask, like can you diagnose this patient or tell me how this patient responds to treatment? So it'd be nice to know that information. It'd be nice to understand, given these characteristics of a patient, is treatment 3 going to do better than treatment 4? Should we give them a surgery or a drug? What does best? Or what disease this person have? So how
Mhm.
do you do this? Well, you can ask a human doctor, but of course they're not always there. We built a tool that could play the same role, given characteristics of a patient, come back with a diagnosis. How do you do this? Well, if you have a doctor, you just look at that, but what if you want to learn a model? So you start with a data set, which has a whole bunch of historical patients described by the same characteristics, but with these historical patients, we knew who had the disease, who was depressed and who was not. And
Mhm.
so machine learning takes a data set of hundreds or thousands or some number of individuals described by tens or hundreds or thousands of features, including the label, including the yes, dot, yes, he has a disease, or no, he does not. And from this finds patterns in this that can then be used as this model that can then, for a new patient, produce an answer. So that's a basic idea. I'm going to talk about that. I also talk about what machine learning can do and what it cannot do, what it's not designed to do.
Mhm.
And we'll talk about combination of features, but other questions that are perhaps more commonly done, which is tell me what feature is most important. It will give some answer to that, but not the answer. It doesn't identify causality. It just
Yeah.
finds a set of features that collectively give this answer. That's the basic outline. There'd be more details, but that's an overall
Mhm.
sketch what's happening.
So giving that whole theoretical framework that you have right now, where are some projects that you're currently working on that's very applicable that you're applying to within the Edmonton community or within Alberta?
Well, uh, I've become unfortunately well known. People from many, many areas know who I am and what I've done in the past. So, and for example, looking at given a patient with, given a woman with with a breast cancer, and given characteristics from her histology, can you predict whether she'll have a relapse later on? Uh, Given a patient who might or might not have depression, can we look at fMRI scans or brain scans and determine whether this patient does have depression or schizophrenia or autism? Looking at an ECG, electrocardiogram, can we determine whether the patient has atrial fibrillation or other cardiovascular diseases, and
Mhm.
a whole bunch of other things like that. These are all, or another one would be, here's a patient with diabetes, with type 1 diabetes. given that this is what that patient had for breakfast, I'm blanking on the word, given the blood glucose level and the intake he's about to
Yes.
eat, can you figure out at breakfast time what his blood glucose would be at lunchtime? Another exciting project is, you guys heard about COVID, right? Is that something we're trying to predict?
It's come around.
It's come around. Yes, indeed it has. Not just at an individual, but at a population level. We do epidemiological studies. Given given the number of cases in, say, Edmonton over the last year, and given the current regulations, the current constraints, the current policies that the government's imposed, and other factors, can we predict how many cases will be in Edmonton a week from now, or 2 weeks, or 3 weeks? How many deaths we have? How many hospital beds would be needed for Edmonton, or for Calgary, or for the province of Alberta, or for the country of Canada? And get very accurate predictions for this forecasting. That's another exciting project. I can go on, but just point out that there's a whole bunch of different things, and whether it's looking at genetic information, what you're born with, looking at fMRI patterns, looking at brain activity, looking at electronic patient records, all these things are just different tools that we can look at to try to make predictions of what will happen next.
Do you have any more closing comments before we end?
This is great, this opportunity. I think people will.
Yes.
I hope the talk is. I've given it a few times before, and to a wide variety of audiences, and they always sort of appreciate. They understand the basic ideas enough to just get started, to start thinking about it. Hopefully, they go forward with that. If they get really interested, there's a whole world of things that go beyond that. I'm interested in survival prediction, which is another tweak on the field, and I've got talks on that. I'm very interested in understanding causality. The simple models I talked about so far are not coping with causality. How do you get that to work? That's a real problem. And I can talk about that as well, but later on. But for now, I'm delighted. You get great questions, and hopefully my answers made sense.
Very, very, very so, Russ Greiner. I really appreciate it. We're under recording right now. Thank you so much for your time, and we'll see you at the DAMA meeting coming up this Thursday.
Look forward to it. 2 weeks.